My name is Raluca AH1, and today we're going to go ahead and administer an antibiotic called Raluca to Mr. John Smith for his infection. We know that Raluca is an antibiotic. It's a bactericidal medication, so therefore we're using it to treat his infection. We're looking for side effects as itching, redness, adverse effects would be super infection. We want to make sure that Mr. Smith keeps his prescription and keeps taking the Raluca even after the side effects or any symptoms are gone, just to make sure that the infection's out of his system completely. We will be starting by checking his doctor's orders. We know that we'll be infusing the medication over 30 minutes. And we will be mixing in the 50 milliliters of sodium chloride mini bag. We have a drop factor of 10, and we know that we will be administering 1,000 milliliters, and we have here 500 milligrams. We'll be administering 1,000 milligrams, and we have 500 milligrams per milliliter. Therefore, that would be giving us 2 milliliters. Also, we have the drop factor of 10, which administering over 30 minutes, it will be 17 drops per minute, I mean, sorry about that. Alright, so the first thing we'll be doing is we're going to go ahead and gather all our required equipment. And then we're going to go ahead and go to the patient's room. Alright, let's go. Alright. Hello, how are you doing today?
Doing alright.
My name is Raluca. I'm your student nurse, and I'm going to go ahead and administer your medication today. The first thing we're going to do again is we're going to make sure that we check the expiration date of the medication to make sure that it is not expired. It says January 2015. Then also we're going to go ahead and check to the doctor's orders again just to make sure that we do have the right patient. And Mr. Smith, can you just tell me your first name, last name, and date of birth? Alright, perfect. And then we'll go ahead and get started. Alright. So the first thing we're going to do is we're going to go ahead and start by getting the medication ready. And first thing I'm going to do is I'm going to go ahead and wash my hands to make sure that we keep an aseptic technique. So I have my hands washed. I'm going to go ahead and use my alcohol prep. And I'm just going to clean up the medication. I'm going to go ahead and get my injection ready. Alright. And I'm going to 2 milliliters. I got my 2 milliliters ready. Using the scoop method. Alright, and we go ahead and we got that ready. And now we're going to go ahead and add the medication to the bag. You can open it up. Inserting it. And then we're going to go ahead and dispose this into the sharps container. We're going to go ahead and mix the medication up. Now we're going to go ahead and label it. We're going to put the name of the patient, so Mr. Smith, the date, the time, my initials, and the dose of the medication. And also we're going to go ahead and put the drug name of the medication. Alright, and we got that ready. Now, we're going to go ahead and attach the needleless device to tubing. So, I'm going to get this. Okay, and we got that. And now we're going to go ahead and put the mini bag up. Now we want to go ahead and we want to label the tubing with the date, time, and initials. So I'm going to go ahead and put the date, time, and initials. And go ahead and label the tubing. We know that the tubing will be good for 24 hours as well. Alright. Now, we're going to go ahead and fill the tubing with IV fluid, at least halfway. Okay. And now we're going to go ahead and prime the drip chamber. And we're going to run solution through tubing and device. So we're going to make sure everything is open. And just let it run. Just make sure it is working. And we're going to close it back up. And just hang it up for a little bit. Alright. Now, we're going to go ahead and drop the 6 milliliters of normal saline in the 10 milliliter device using the septic technique. And now we're going to reassess for any allergies. So, Mr. Smith, do you have any allergies that I should know of? Any allergies to cephalosporin or to penicillins,
No.
gloves, latex, anything?
Mm-mm.
Alright. We're going to go ahead and wash our hands again. And then we're going to go ahead and apply clean gloves. Let's go this way. Alright, now we're going to go ahead and assess the IV line for patency. We're going to palpate the IV insertion site for phlebitis, so pain, heat, edema, erythema, or infiltration. We're going to check for the skin being cold, pale, wet, anything like that. We see there's nothing wrong with the IV insertion site. And now we're going to begin by aspirating. We're going to go ahead and start cleaning up the site first. Okay. So now we're going to use the ASASH method. So first thing we're going to do is we're going to aspirate. And we see blood return. Now we're going to go ahead and administer 3 milliliters of saline. Okay. Now we're going to go ahead and administer the drug.
we go.
And as we know, we're going to go ahead and infuse this over 30 minutes. And the drip rate will be 17. Alright, Mr. Smith, I'm going to go ahead and check with you in about 30 minutes, okay? I'm going to go ahead and take my gloves off and wash my hands thoroughly. And then I'm going to make sure I get my new gloves to apply when I go back in the patient's room. So now it's been 30 minutes. I'm going to go back to the patient's room. Hi, Mr. Smith. How are you feeling? I'm going to go ahead and wash my hands one more time. I'm going to go ahead and apply gloves again. Alright. Now we're going to go ahead and make sure close this off. And we're going to check for phlebitis or infiltration. And there is no phlebitis or infiltration. We're going to go ahead and clean the port with alcohol again. And we're going to go ahead and attach the syringe one more time. Make sure that this is open. We're going to aspirate. And then we're going to gently flush 3 milliliters, again, using the push and stop method. Alright. Now we're going to go ahead and clamp the INT as I withdraw the syringe. Now I would apply an alligator clamp to tubing for the next administration. I would have to say that the H in a sash is only used when when there's a written order from the doctor for a PICC line, flush, or a cervical line dressing. Of course, I'm going to monitor the IV site for edema, pain, tenderness, redness, and any allergic reactions while administering the antibiotic. And then afterwards, I would make sure that I document the use of the MAR. I would record the time, date, and I would make sure that I state the condition of the IV site, and I would record the amount of fluid given to the patient.